So I participated in the phase 1 study and in the randomized phase 2 trial, and in studies afterwards with lenvatinib and everolimus, including the pivotal phase 3 trial that's currently ongoing with lenvatinib everolimus compared to lenvatinib pembrolizumab compared to sunitinib in first-line treatment, a nearly 800 patient trial referred to as the clear cell trial to investigate the lenvatinib everolimus regimen and lenvatinib pembrolizumab in first-line therapy. As part of standard management and in the earlier studies, the phase 2, I mean, my experience with lenvatinib everolimus has been very favorable, particularly with regard to its efficacy. There's certainly safety aspects associated with that, with a frequent dose reduction. Most patients do experience an adverse event of one type or another, but I felt that overall the adverse events are manageable and have been very impressed by the efficacy for the regimen. The lenvatinib everolimus, lenvatinib is a typical tyrosine kinase inhibitor, and so its predominant side effects include hypertension. It can cause diarrhea, can cause skin toxicity. One of the the adverse events that we see that higher with lenvatinib compared to some of the other TKIs like sunitinib and pazopanib is proteinuria as well. So those are important to monitor in patients treated with lenvatinib. Everolimus, very well tolerated drug, adds little to the toxicity. The main side effects with everolimus are stomatitis, and also it can rarely cause pneumonitis. So in the combination of lenvatinib everolimus, overall it was pretty well tolerated for patients in the phase 2 trial, although frequent dose reductions were required. In that study, about 60% of patients required a dose reduction, which was generally of the lenvatinib. So oftentimes toxicity is seen with that particular regimen, but one of the kind of philosophies of that regimen is to start out with full dose, anticipating that many patients will require a dose reduction. The dose reductions are most commonly occur for hypertension, diarrhea, or the proteinuria.